Welcome back to TV5 News at 9, everyone. Today we are talking about proton therapy and liver cancer. So to tell us all about it, we have Dr. Hesham Gayar calling in. Thanks for calling in, Doctor. How are you this morning?
I am fine,
All
and
right.
thank you for inviting me.
Yes, we love to have you. Thank you for always sharing your expertise. So to start us off, just give us some insight into what really is liver cancer.
Liver cancer can be primary cancer of the liver, like hepatocellular carcinoma or cholangiocarcinoma. These are cancers that start in the liver or in the bile tree that transfers the bile juice. So these are primary cancers that start in the liver. You can also have cancer in the liver that is spread from other cancers. And nowadays, the treatment for cancer, even if it has spread, is we still try to seek control of the tumor and attempt to treat it like for cure. And that has been shown to have better outcome, and the patient can survive more without disease, or more chances of survival for longer time without cancer. So primary liver cancer is very significant and serious, like hepatocellular carcinoma or cholangiocarcinoma. The outcome is significant, and often it is in areas that cannot be removed easily, and can be treated with surgery and or radiation, especially if the number of or the size of the tumor is in a good size, limited to one area of the liver. The outcome is better. Surgery is limited when it's in the central part of the liver, and or if there is more than one lesion. Treating the cancer when it is spread is part of treating the whole philosophy of the cancer. So it's a teamwork, and radiation is used for treating cancer of the liver, obviously, for different indications according to the site. Many cancers, like cancer of the gastrointestinal tract, the stomach, the colon, pancreas, and so on, can spread to the liver, and those are called secondary cancers. To simplify the answer, there is primary cancer of the liver, like hepatocellular carcinoma or cholangiocarcinoma. There is cancer that spread from other organs to the liver. All are serious, and sometimes the primary cancer is cured, and now we need to take care of the problem in the liver, and that can lead to better survival without disease.
Very good. Thank you for that, Dr. Gayar. So what kind of risk factors are typically associated with liver cancer?
Liver cancer, the liver is a very sensitive organ, and it's like the factory that process all the food that we digest, and other factors and other functions as well. So it's a critical function, and the problem with it is it's very sensitive to radiation. So regular radiation, when you treat a target in the liver, unfortunately, the spread of even low doses of radiation can affect the function of the liver and can lead to sickness or even death from the regular radiation treatment. That makes radiation oncologists sometimes shy from treating, or treating accepting morbidity. And because of the sensitivity of the liver tissue. Also, it is next to critical organs. It's just below the heart. For example, it is below the right lung, and it is close to the bowel. The stomach is very close by. The transverse colon is touching it. So it's surrounded by critical organs. The right kidney is right below the right lobe of the liver. So to treat the liver and accept radiation to those organs can be a problem. And that's often a limiting factor when we're treating it with radiation.
Can you run us through what proton therapy treatment might look like for liver cancer?
All right, good question. Proton therapy is a special type of radiation that is particle therapy. Tiny, tiny particles that when you shoot it, it stops at the target, and it deploys 80% of the radiation where it stops. So it's like targeted therapy by particles, and what the advantage you get from that treatment is avoiding normal tissue receiving unnecessary radiation. So with regular radiation, the radiation goes through the body. If you send a beam, it continues going through, and everything in the way before and after gets treated. While with proton therapy, the particles can be put spot by spot where it belongs, using a limited number of entrants. And the dose is delivered only at the target, sparing about 70% of unnecessary radiation to critical organs. For the liver, because of the critical organs surrounding are significant. We're talking the liver, the heart, the lung, the stomach, the colon, the bowels. These are critical organs. The liver itself is a critical organ, and the extra radiation spilled to the normal liver can be a limiting factor. But with proton therapy, since we spare all those organs, outcome is better because the patient is healthier, can take the treatment easier with less side effects and better quality of life. And we actually can treat and cure while conventional radiation cannot. And unfortunately, you will not learn that unless you speak to a proton therapy expert.
Dr. Gayar, do cancer patients all have the option to use proton therapy as a treatment option?
Yes. Proton therapy can be used in any radiation treatments because of its specificity and the fact that it's focused at the target and reduces the dose around the target. It's more important for tumors around critical structures. So everybody can be treated with proton, but we have a waiting list and demand on the beam that we need to select who will benefit the most from this particular treatment, because there is limited number of machines.
Yeah.
And there's only 2 in Michigan. We have the largest one of them. So because of that, we have to pay attention to who deserves that special treatment. And it goes for patients with critical organs surrounding the target that need to be spared, and they take priority over others. And liver cancer is one of those.
Dr. Gayar, how would someone reach out to see if they can be a candidate?
And that's a great question, because you don't know, and you have cancer. Does it work? Is it needed? Is it one of those indications? And you can simply call us by calling 855-MY-PROTON or reach to the website mclaren.org/proton treatment, and we'll chat online or talk to us by phone. We will evaluate. There's a navigator that evaluates your case or your relative or family member's case, see if you are a good candidate or not, or have a telehealth visit with the physician, and we can discuss and see how we can help before you even make the trip. And if it works, you can come and get the treatments. Insurance does cover it. Medicare covers it for all cases, and insurances cover it as long as it's a good treatment for the cause. And we only do it when it's a good treatment for the cause to make sure the right patients benefit from the technology.
Very good. This has been great information to have. Dr. Gayar, thank you for your time this morning.
My pleasure.
All right, thank you. Yes, again, and you can find more information by going to the hot links section of our website, WNEM.com.